Hello, good day, everyone. My name is Carl Stephan Paris. I'm a clinical lead in one of the care homes here in the UK.
Would you like to study for the OET but can't seem to find the time? Do you need an excellent OET provider who can flex with your needs? Then choose OET Flex. OET Flex allows you to decide when and how you study the OET on demand. Take Italian qualified nurse L for example. She needed to pass the OET to work as a nurse in one of the best children's hospitals in the UK. She was working as a healthcare assistant for over 40 hours each week. So she chose OET Flex with native OET teachers online, in person and timed around her work for 5 weeks. And guess what? Nurse L passed her OET the first time. Learn more at www.oetflex.com.
How is it to work in a care home? Today we have a very special guest.
Hello, good day, everyone. My name is Carl Stephan Paris. I'm a clinical lead in one of the care homes here in the UK.
Basically, on the most basic, what does a care home nurse do?
So, a care home nurse actually has a primary responsibility of taking to the welfare of the residents in a facility or specifically in a care home.
Mhm.
You would be dealing with most residents, and well, in our case, we are dealing with residents who either have dementia, Alzheimer's disease, or Parkinson's disease. And of course, we would be looking after the medical needs of these residents since they don't actually comprehend what their needs are.
Mhm.
And other than that, we cover the physical, social aspects of their health as well, and also of their mental well-being. And and to that point as well, that we would actually be collaborating with the other members of the multidisciplinary team in the community, like the dietitian, the physiotherapist, the chemist, or the pharmacist, since we don't always have them within our reach. So we would be doing referrals as well.
You mentioned about you being the clinical lead of this care home. So, how do you function now as a clinical lead in a care home?
So, as a clinical lead, I'm already in a managerial level in our care home.
Mhm.
So, I would actually be helping our care home manager dealing with managerial activities such as audits and
Mhm.
also managing our carers and our nursing staff. This is a lovely workplace to be in, especially when you're working with elderly people, and you'd also um, be sharing your empathy towards them, and it's just a really lovely relationship between you and the residents. Really gives you a bigger salary compared to the hospital. You'd have a band 5 salary working
Yeah.
as an entry level nurse, but when you're working as an entry level nurse in the care home, you'd have a band 6 salary. Is quite rewarding, especially when you get close to your relatives, to the relatives of the residents. It is quite rewarding when they actually mention you in their cards or post you on social media that my nan has been taken care of by a nurse named Carl. It was quite a wonderful experience with them and things like that. It is really rewarding, and it's second to none, really.
How's that different? And is there any pros and cons on each side?
Working in an NHS hospital and in a care home are two different worlds, basically.
Mhm.
Um, NHS hospital, when you're working in an NHS hospital, it's more acute. So, and you're dealing with different people almost every day because you're not always giving care to the same person for quite a long time. It's always short term because they're not always there. So the good thing about the NHS hospital is that medical professionals are always within your reach. You'd get advices from them straight on, just like a snap. Or there's no medical professionals around other than nurses. So if you need a medical advice or a professional advice from a multidisciplinary team rather, you would have to get a referral, which would take some time compared to having it in a hospital setting. Have a daily routine when you're working in a care home. um because you know all these residents because they've been with you for such a long time, and compared to the hospital, you're never with the same patient because you probably work in one bay on this day, and the next day you'd be working another bay, so that's a whole different routine already. In my case, I think working in a care home with a daily routine is much easier because you go straight to that door and you know what's going on already. You know what you're gonna do for the whole day, and then you're just gonna do it and then go home right after.
Right. So you how I see it, and correct me if I'm wrong, in a care home setting, you can provide a more personalized care because you know these the residents. They're not even patients; they're residents. Yes.
Mhm.
Whereas in a hospital, especially in an acute setting, the transition, the ins and outs happen more frequently. So you don't really
Yeah.
get to know the person behind the patient. After they're gone, they're gone. Hopefully,
Mhm.
they don't come back. So, um, being on the front line in the care homes, how does the COVID virus affect you guys? Your
It literally affects it a great deal since we're a facility full of vulnerable people. So it's really difficult because currently in a care home we are all in a lockdown. So no one could come in, no visitors could come in, and um already in that aspect it already affects the mental well-being of a resident since let's face it, like the only happiness of an elderly person would actually be seeing your family, and which is quite emotional for some of us because some residents don't really know what's going on because of their dementia, and we're trying our best to cater all their needs and especially helping with their mental well-being by doing virtual calls like these, so they could see their family through Skype or through any virtual conversation, and they just see their family on the screen and they don't know what's going on, and they just look at us um there's our family in our screen, but what's going on, and it just really breaks our heart.
what would be your advice to any aspiring nurse who wants to work in the care home setting?
Working in a care home is a whole different world. It's really different from the hospital. Um, as a care home nurse, you get more autonomy regarding to your medical needs of your residents. So you'd have to hone that skill as well. And other than your medical side of your skill, you'd also have to strengthen your emotional core because um working in this kind of environment is never easy because you get to have a connection with the residents and always an emotional journey when you actually see someone who's actually um going from healthy to being poorly and then sadly passing away, and that's never a good experience, and it's never a bad thing to actually cry for a resident. You still have to maintain your professional stance, but it's never a bad thing to actually care for a person because as nurses that is actually our job to care for a person, and we have to cater their medical needs and also to cater also all the aspects of their mental and their physical well-being. Always
Manong knows
remember,
best,
Manong
put your
knows.
worries to rest when staying in the United Kingdom. Manong knows best.